I also want to tell Kenyans that we also have our processes and procedures. If we find that somebody is unwell on board an aircraft, we are notified by the aircraft. Once the port health officers are notified, they come and pick the passenger from after disembarking from the aircraft. We pick the passenger or the patient, we take them to our clinic where they are checked. If they need a referral, then we call Kenyatta National Hospital where they are transferred for further assessment. Equally, we have an isolation center here at the airport. If the person needs to be isolated, then we already have a facility that can isolate individuals who are found to be unwell. I want to assure Kenyans that we do not have any confirmed case in Kenya. And I want to allay any fears. Please let us remain calm. We are in control and the country is under control. We don't have to have any fears as at now. We only need to be very careful on whatever that we are doing and prepared. Therefore, let us not spread rumors, let us not spread information that is going to cause panic to members of the public. Please, I want to seek the members of public that they should only listen to information that is coming from the source, and that is the Ministry of Health. Let us avoid spreading information that is unverified. And if you need to get any information, we have our number 719 that you can also send questions and also ask questions on what you need to do should you find yourself in a tight corner. We are working very closely with other ministries that work at the border points, and the coordination is good. We will also be going to other points of entry, including sea and land, to also check their preparedness in the next few days. We are going to deploy more healthcare workers to the ports of entry as from next week. So public health officers, we are also encouraging them that they will register with us so that we are able to see where we can deploy them as soon as possible, because we need to also enhance the teams that are on the ground. We have our rapid response teams are ready. So in case of anything, the teams that are already set aside, they are ready to move very swiftly and ensure that any case is dealt with. We are in collaboration and in coordination with the authorities from the other countries that are affected to do exit screening from the destination country. So anybody, before they board the plane, they are screened, and when they land in our country, they are also screened. The Ministry of Health is doing whatever possible to ensure that we contain and we are prepared. At the ports of entry, we are doing screening, and in JKIA especially, we have designated Gate 16 for flights that are coming from those countries that already have issues. We have also expanded the mandatory screening for 10 countries that are our neighbors. So any flights that is coming from the neighboring countries, we are also making sure that we have screened. We are also conducting the aircraft wastewater surveillance at JKIA. And once we collect the wastewater, it is taken to the labs. And this to check on the pathogens that are important to our country through wastewater. Remember, this can give us the patterns of the diseases that are likely to have been imported into our country. Diseases like polio, diseases like cholera, meningitis. We are also able to check on mpox, and now we are also introducing issues of Ebola. Therefore, it is a good thing to do to ensure that the wastewater surveillance continues. Ebola is caused by Ebola virus. And again, there are signs and symptoms that you need to see whether you are the one who have the signs and symptoms or you know somebody who has the signs and symptoms. Is a fever, headache, abdominal pains, vomiting, diarrhea, joint pains. It would be important if you observe such kind of signs and symptoms, you rush to the hospital and ensure that you're treated. Do not go to the chemist to treat yourself. Ensure that you avoid unnecessary travels to those countries that are already having cases. You can just wait for some period of time to ensure that these issues go down, and then you can travel later.
That's on the thing, yeah? You pass through this door, and the officers are here telling them to sanitize masks. And then the queue. Then the queue now for the screening process. So when they reach there, first thing they use their coat, temperatures, and then then have a desktop. Some of them are captured suspects, but so far we have not gotten one suspect. Mr. Matters? Yes, welcome. They normally screen like 9 or 7 or 7 flights. So meet Madam Yes, you can explain now what you do. Yeah, most of the time when there's not usually come. They usually come this way.
Siwaoni hapa.
Nimepata kidogo sana.
Asante kwa nguvu yako. Tutafanya mambo bora sana. Mali kidogo tumeanguka.
You are ready? Jaji, ziko wapi notes zako? He's still writing.
Sana.
Karibu bwana.
This is our judge.
Last time I was here,
Yeah.
this place was closed. Was it here or was
Ilikuwa huko.
it was inside?
Yeah.
Oh, you
Yeah.
Tulitengeneza. It was raining. Ilikuwa inanyesha na hapo nini. Bwana. So we did it.
was looking very bad. So this is the basic clinic, isn't it?
Yeah.
Yes.
Steady. I'm a clinical officer. Welcome to help. So this is where we do our consultation services. When a patient comes, it's a trial area outside there. Then from there they weigh whether it's a clinical case or a case that requires vaccination. If it's clinical, they are brought here. We take their history. Then from there we treat. Whether the was wengine wote wa
So you're in front, Brian? Yes. That is a patient coming. By the airline, by
Okay, we receive a call from the airline, so we go and see the patient. The patient
Is for referral, we refer to KNH. KNH is our referral facility. Yes.
so that we just
Sasa hivi yes.
So that's one of the surveillance we take. And pathogens come from there.
So this is surveillance from
The aircraft.
the aircraft.
Yeah, so we take wastewater. Every time a tornado comes, we take samples.
Okay.
Because we want to know the pathogens that the travelers are bringing
Actually,
into the
this
country.
is for genomic
Genomic
sequencing.
sequencing.
Okay.
Yes.
It's
So
done by the
every time an aircraft lands, we take the water,
wastewater.
the wastewater,
Yes.
and we keep it here for
It's kept here to be.
airport, and then I'll say 1, 2, or 1, 2, then I welcome Mr. Mukomen also to say welcome.
Our guest, Madam PS, this is the BMC, Border Management Committee, since we did the airport. I don't know whether I can allow them to quickly introduce themselves.
say our name and
Yes.
where you are.
Thank you. So quickly say your name, and then you say your agency, and then
Rosiano, Public Health Department.
there, then
Malcolm Moiru, okay.
there.
Kennedy Moedi with the PhD.
Of course, for the representative here at the airport, who are part of the Border Management Committee. We have duty department and the port health team here at the airport. We are also doing sensitization of the airport staff, and we are getting support also from the airlines, informing the traveling public. I know you support the area. Welcome.
Thank you, Mr. Oseko, the manager, very good brief. Yeah, so just to make a small brief, Madam Place, this team we are seeing here, it's a weekend majority of them had traveled when we received the news that you are coming. So we convened here and we strategized. That's why we decided, because Gate 16 is convenience, there's an isolation center, and it's near